On April the 25th, there was a devastating 7.8 earthquake in Nepal.
The devastation was beyond what I had anticipated.
It was shocking from a perspective of what little these people had. And it was shocking to see what little they had gone.
International Medical Corps was notified that potentially the Trauma Surgical Deployment Unit, which is for us the mobile field hospital, which we are attached to as a team in combination with Massachusetts General Hospital and Stanford. They requested a team of nurses and one logistics person to respond.
Take care of yourself, right? There.
And there were two missions. One would be to reach the outlying areas which are very rural, hadn't been touched, and that would be in the Gorkha district. And the other one would be a deployment to Dading.
So we were in the Dading district. We had 6 different missions, so 6 different villages that we did clinics in.
There was crush injury from falling debris or being trapped in the rubble. Those that we felt were significant injuries were flown out. We would take them back by helicopter to the hospital in Kathmandu.
For me, I acted as a pharmacist during this time frame. I just had a running list, so I'd go through all the different meds and what it could be used for.
We deployed into 7 different areas. We were based in Gorkha. We went into very extreme situations where they lacked food, shelter, water in some situations.
Well, I had the advantage of getting to see every patient in every village, and there was a broad spectrum of diseases, from really acute injuries that maybe were broken bones or injuries directly related to the earthquake, to the full spectrum of chronic illnesses.
We did also see a lot of psychological trauma from the earthquake, and that manifested itself in a lot of different complaints that were absolutely real physical complaints, but were brought on by the stress and the environment.
Our teams actually never saw each other from the time they arrived and were split up till the time they got back together to come home again.
We found out that people were walking from 10 or 12 miles away in this rugged terrain to get to us.
This was a young man, 36 years old, and he was, the major breadwinner for his family. And he was really having to make a decision: do I stay and help my family ensure their safety by rebuilding their house, or do I go and see if I can get my medications refilled? And these are medications that are life-saving. Without them, he had a real possibility of dying. So we were able to coordinate with IMC and with our helicopter pilots to get him airdropped the next day the medications that he needed.
The day of the 7.3 earthquake, we were preparing to leave the village.
And as we walked out into the street, I would say hundreds of people were running down the street screaming, children were crying.
Literally within 5 to 15 minutes, I had been verified, I was able to verify that our team members, both teams, were safe.
People there are going to be living with this level of anxiety and fear and real threat for a long, long time.
This is the first time I actually have become emotional about this, but I really formed great relationships with these people. And they're young, and they still need a lot of mentoring and support.
8,000 people died. We treated over 2,000 people. I feel like we really had a huge impact.
We think that the lessons learned are really, really important that our team can bring back and then teach others in our own organization and in the community and frankly nationally. There's the team of 5 that deserve all the credit in the world for what they did, but there's also a support team here at home that deserves a lot of credit for being available 24/7, in contact with the team daily, at least a couple of times a day, without a whole lot of recognition, but they play a very important role as well.
I feel that the entire Scripps community, all of the employees, all the physicians, and really everybody that supports us all as Scripps employees really made the difference. We were just privileged to be there to represent, and I know that I certainly feel very proud of having had the opportunity to do that.
It's felt really like an entire family was there with us, and an entire family has brought us home.
Why do we do it? Well, number one, it's the right thing to do. And I think Mother Mary Michael Cummings and Miss Ellen Browning Scripps would be proud of the fact that The missions they establish here in San Diego literally can reach around the world at a minute's notice now. But we get a lot back in return, that expertise that you just cannot buy and train for. So we're going to be better prepared if and when a disaster hits us here at home.